If you care about your heart, you gotta put the Twinkie down. Continuing my series going over AHA's new dietary guidelines, today we're going to be merging steps 6, 7, and 8 because they all follow a similar message. Step 6 is limiting your consumption of ultra-processed foods, 7 is limiting your consumption of added sugars, and 8 is going to be watching out for excess sodium intake. Now, ultra-processed foods tend to be very rich in added sugars, sodium, saturated fat, as well as being poor in essential nutrients, especially fiber. The AHA recommends drastically reducing your intake of added sugars from food and beverages because they have been linked to an increased risk of type 2 diabetes and obesity. And it's been shown that consuming 25% of your daily calories from added sugars can lead to a 3-fold increase in cardiovascular disease risk. Number 8 is going to be picking a low sodium diet. The average American consumes about 3.3 to 3.5 grams of sodium per day, whereas the RDA for healthy individuals is 2.3. And the RDA for clinical populations is 1.5. And it's very easy to see this because a lot of the foods we consume have added sodium, especially if they're processed food. So try to limit these. When you're cooking, use a little bit of salt and add more of your other seasonings to augment the flavor profile. Research has shown that excess sodium intake is correlated with increased blood pressure and cardiovascular disease risk, especially for salt-sensitive populations. There is a salt-resistant population that may not be as prone, but error on the side of caution. There is an exception for this. If you're an athlete or somebody that's spending a lot of time out in the heat, you are going to need more sodium because you're losing a lot of it through sweat as well. Similarly, for added sugars, athletes burn through a lot of stored sugar when they're training, especially in high-intensity bouts, so it's important for them to replenish those stores, and sometimes it's okay to use added sugars when it's coming from something like Gatorade. If you're a normal person who's spending most of your time in an air-conditioned environment and you're not exercising for more than 60 minutes a day at moderate to high intensities, then you may not need those added sodium or sugars. So watch out for these to try to improve your heart health. Side note, there are low-sodium salt alternatives that are potassium-based, but if you are a cardiac patient or somebody who has a history of cardiovascular disease, consult your cardiologist before making this lifestyle switch.